While tens of thousands of refugees are finding new homes in Europe, another refugee crisis is just as acute in Southeast Asia, including Malaysia. While there are more than 150,000 refugees recognized by UNHCR in Malaysia, they do not have rights to free medical services, employment, nor can they pursue education. Fortunately, since 2004, Tzu Chi has formed a partnership with UNHCR to provide health care to some of their refugees. In today's Tzu Chi's 50th anniversary series of reports, we'll look at how Tzu Chi volunteers in Malaysia have brought medical care and love to refugees there. In the suburbs of Selangan in Selangor, one finds refugees from Myanmar gather at shops and shanty rental apartments here.
My name is Shandu, and I am 42. When I first came to Malaysia, I did not know much. My employer treated me poorly, making me work all day and paid me 10 ringgits a day.
Shandu and his family of 6 live in a small space configured by wooden dividers and endure much hardship in Malaysia. Working 2 jobs, Shandu's main income is from his work at the Selangan wholesale market.
The Chinese shop owners hire foreign workers. While locals work 3 days a week, foreign workers work 7 days a week, and they are willing to do anything. If you try to order a local worker around, he might ask you to do it yourself. This is downtown Kuala Lumpur, also known as Miniature United Nations. Foreign workers from 12 countries make a living here. According to official statistics, there are between 4 to 5 million foreign workers in Malaysia, making up 30 to 40% of the workforce. It shows that Malaysia highly relies on foreign workers. In addition to foreign workers, there are also more than 150,000 refugees recognized by UNHCR in Malaysia. 90% of them are Myanmar refugees, mostly Chin and Rohingya minorities.
The main problem for refugees here in Malaysia, as in other parts of the region, is that they're all treated like illegal migrants. And because they're illegal, they have no rights. And people with no rights here live in a very difficult, exploitative zone of society. Those who work get exploited. There are people who prey on them on a daily basis, asking for their money. There are challenges for women and children.
Refugees in Malaysia cannot reside legally because Malaysia did not sign the 1951 Refugee Convention and the 1967 Protocol. Therefore, refugees do not have the right to work, nor can they seek free medical treatment like other Malaysian citizens. Since 2004, Tzu Chi has formed a partnership with UNHCR to provide health care to some of the refugees, with a memorandum of understanding and the refugee aid program.
There are many challenges partnering up with the UNHCR. Its annual funding is unstable and they are also trying to get more funding. We do not just work together with them. We do more, even if it's beyond our agreements.
At the Free Clinic Center of the Tzu Chi Selangor and Kuala Lumpur, you can see Burmese written on the sign. Starting in 2008, it has been serving refugees, mostly Chin and Rohingya minorities.
I am afraid of being caught by the police, but I must come to the Free Clinic Center today because my son is seriously ill.
Responding to the desperate needs of refugees, Dr. Fu Si Lian, who joined TIMA in 2013, gave up his high salary at a private hospital in May of last year to become the only full-time doctor at the Free Clinic Center.
I used to be self-centered and thought about going to a private hospital to make more money. Then I asked myself, why do I need to earn so much?
I decided to stay and work at the free clinic center to serve more people.
This Rohingya refugee is taking a photo with Dr. Fu before leaving for the United States.
Thank you.
Sometimes my heart goes out to the refugees. Excuse me. I know that although some of them can move to a third country, they will face hardship there. They must start all over again and face a lot of regulations. In addition, the UN no longer protects them after their initial 3-month stay there, so they will be on their own.
Our Prophet Nabi Muhammad SAW said on the one hadith, if someone comes to you, you don't ask where are you from, you don't ask what kind of races you are. You ask them what you need and what we can do for you actually.
Each family, the content.